These are the Biacuplasty probes, 150 mm the length and 6 mm active tip. This is Coolif RF machine. Here is the attachment of the cable and RF probe. The patient is prone in the position. Now we can see here, please show the Siam. Now we can see here how beautiful is the Scottish dog appearance. This is Scottish dog appearance. And this is L4, this is L5. And this is the superior artery process. This is the head of the dog. This is the neck of the dog. This is the anterior leg. This is the horn of the leg. So this is all a Scottish dog appearance picture for the entry of the needles. So first of all, we are injecting the local anesthetic agent just lateral to the superior arterial process of the injecting the local anesthetic agent. So Biacuplasty is a bipolar procedure. We need to start the procedure in both the probes simultaneously. So we will inject both the side local anesthetic. Show me the. So in this view, this is the opposite side, and in which also here again we will see in the Scottish dog appearance and inject the local anesthetic agent just lateral to the superior arterial process of the vertebra. And we are injecting the local anesthetic agent in the tunnel view, just parallel to the beam of our Siam machine, and wait for the 2 or 3 minutes to effect of the local anesthetic agent. Right side first. So we will introduce our RF needle on the right side first. So we can say how beautifully this is the needle in the tunnel view, and now in the same trajectory or in the same entry of the needle, now we are injecting the RF needle, and our needle should be in the beam of X-ray. So we can say the entry of the needle is exactly in the tunnel view, just lateral to the superior arterial process, and this is the ideal entry point to enter into the disc. Inside more, just show me. Okay. We will introduce the needle up to at least at the facet joint line. We will introduce the needle. ठीक हो आप? कोई दिक्कत तो नहीं है? चलो. Sometimes if the patient is over apprehensive, we can add some sedative drugs also. Now from the left side we are introducing the needle. देखो. And now show lateral. We will gradually introduce the needle toward the disc or inside the disc. The final position of the needle will be posterior 1/3 of the disc, and if we see in the anterior view of the SIAM screen, it should be just lateral to the medial pedicular line. These are very safe in the local anesthesia for the discogenic pain, and patient get relief instantly, immediately after the procedure. If the our diagnosis is only the discogenic pain, annular tear, and any degenerative disc. So we can say in the lateral position, our one needle is just touching the end plates, so we need to change. Annulus is painful. देखो, this is just entering the needle. See the position of the tip of the needle in the posterior 1/3 of the disc in the L4 L5 level. AP. Important that the tip of the final position of the tip will be just lateral to the middle pedicular line. It must not cross the pedicular line. So it is we need to now it is just medial to mid pedicular line, and this I need to adjust accordingly. देखो, now it's just touching the, थोड़ा ऐसे करो. SIAM position is very important in this procedure, because if we are not in the true AP view, it seems that it is touching to the end plates of the L4 vertebra. Now it is correct in the position. We are in the posterior 1/3 of the disc space in the lateral view, and in AP view just lateral to the middle pedicular line. Now we are inserting the Biacuplasty RF probe in the RF needle, and first of all we start with the check for the sensory and the motor. Now again we are checking for the motor and sensory response. On the machine, increase the voltage. This is we are checking for the sensory stimulation. Increase. So there should not be pain and paresthesia beyond the 1 to 1.5 volt. Okay, start with bipolar. Local. The bipolar procedure, both the probe will work simultaneously, and there will be a elliptical lesioning in the disc in the annulus. In this patient we already had endoscopic decompression. The diagnosis of the patient was in MRI is annular tear at L4-5 level. You can see this is the Cooley machine, and this is the bilateral probe. The final position is the posterior 1/3 of the disc, and in AP position we can say, please show the SIAM screen. This is the image in which the position in the lateral is the posterior 1/3, and in anterior there is the entry of the needle is just lateral to the middle pedicular line.